Hello, everybody. Welcome once again. This is a patient education program, what we have initiated at Gunasheela Surgical and Maternity Hospital. And we call this as Ask a Gunasheela series. This is the second video that we are actually uploading. And in our previous video, we have discussed regarding the basic what is endometriosis, as well as what are the symptoms which are involved in patients with endometriosis. So further to that discussion, I'm Dr. Ashwini N. I'm a senior consultant here, and with me I have Dr. Ashwini M, who is also a senior consultant here at Gunasheela Surgical and Maternity Hospital. So we are going to move forward with endometriosis and infertility. So Dr. Ashwini, please throw some light on how common is endometriosis in patients with infertility.
Women who come with infertility to hospital, in women who are visiting to us, endometriosis is a most common condition what we see. It affects about 50% of infertile women. In endometriosis, there are various categories like mild endometriosis, moderate and severe endometriosis. So mild endometriosis is seen in about 2 to 5% of patients, and moderate and severe is less than 2%. So it is common to have women with endometriosis. What we also see is when women come with endometriosis, they are associated with diminished ovarian reserve. So one thing we would like is it's more common in infertile women, and it depletes her reserve. So the woman should not waste much time on like any other woman. She doesn't have a long reproductive span. So women with endometriosis once you're diagnosed, you should make sure to complete your family as early as possible.
So there are few things that the endometriosis per se causes, and it hampers infertility. So let us have a small, knowledge as to how this happens. So basically, what happens in endometriosis is there is presence of ectopic endometrial tissue. So most common site where we see this is in the ovaries. So what happens is this presence of endometriosis in the ovary, it actually eats up the normal ovary. So the bigger the endometrioma inside the ovary, the more the damage to the ovary. So it affects both the quality as well as the quantity of the eggs. So that is one of the main problems of endometriosis, which would lead a woman towards infertility. So
it also, what happens when this endometrium is present in the other places, it causes like it is there, it acts as a small irritant, and it results in adhesions. Adhesions means where one structure gets stuck to each other. So what happens, there is an alteration in the tubal and the ovarian relationship. So the ovaries so many times get buried behind the behind the uterus. The tubes are by the side. Sometimes it can also result in clogging or blockage of the tubal ends, resulting in swelling of the tubes, that we also called as hydrosalping. So or everything can get stuck, a tube, ovary, everything gets stuck together and form a tubo-ovarian mass. So that is the thing. And this endometriosis, it affects every part. It affects the quality of the egg, it affects the tubal motility, it has an impact on the sperm, it can affect the endometrium, so it decreases the implantation rates, and also it, like we already have told, it decreases the ovarian reserve of the woman also.
Usually if the ovary is like this and the tube is around the ovary like this, so once the egg gets released, it is immediately picked up by
the tube.
So what happens in endometriosis is usually there is what is called as adhesion. The ovary goes and gets stuck somewhere, the tube goes and gets stuck somewhere. So once there is ovulation here, the relationship is altered. So the egg cannot be picked up by this tube. The egg gets missed out somewhere else. So that is what is one of the causes of infertility in endometriosis. And also presence of this endometriotic tissue in the uterus, it causes some inflammatory changes and also changes the gene expression patterns, which affects the process of implantation. So it affects both the egg quality, the tubal and ovarian relationship. Also, it alters the implantation. Hence,
it creates a kind of a inflammation kind of a picture everywhere. So because of that, it affects every step of fertilization and implantation.
So this is how women with endometriosis finally end up
With
with
infertility.
infertility. And this is one of the main common causes of infertility, which we see in our day-to-day
practice. So, Dr. Ashwini, can you throw a light? How do we diagnose endometriosis?
Most of the time, patient comes with history suggestive of cyclical abdominal pain, or sometimes excessive bleeding, or they may have painful periods, and they can have pain during intercourse. These are all the history which are suggestive of endometriosis. When we examine also, sometimes we can feel these. If the ovaries are very much enlarged, we can feel the bulky ovaries when we do a vaginal examination in the women. Or
Some
we can also feel
tenderness,
pain.
we can when we do an examination, they can have pain. So that's
and
another
sometimes
thing.
the uterus is also bulky, suggestive of adenomyosis. These are all the salient features which we can pick up during history as well as examination. Our
the first line of investigation will be an ultrasound. So when we do an ultrasound of pelvis, we can see presence of these cysts in the ovary, or then we can see, like Ashwini told, in the uterus will be bulky. Then the relationship of the ovary will be altered, like we can have an idea whether
the ovary can be stuck
to the
somewhere
posterior
to the uterus.
surface of the uterus, or somewhere it would have stuck to the lateral pelvic, I mean to the sides of the pelvis. So such things sometimes they can present like even the tubes would have swollen, and we can see on the scan like in a swollen mass, I mean like a tubo-ovarian mass we can have. So
these are all the salient features what we see on
ultrasound. And then another what are the other tests to confirm?
So the gold standard what we consider is a laparoscopy. So when we go in, put a laparoscope, which is a camera which goes inside the abdomen. So this is the picture that we get, a laparoscopic picture where we can see the uterus. Sometimes both the ovaries, or sometimes only a single ovary is enlarged with a large cystic mass which contains this chocolate colored fluid. So it is an altered blood which is there. And sometimes we see the ovaries stuck to various parts in the pelvis, or there can be swelling of the tube, or the tubes can be blocked because of adhesions. So there are so many pictures that we see on laparoscopy. It depends, like mild degrees of endometriosis, the things are not as bad. There may not be that many adhesions. There can be presence of only one or two small endometriotic cysts. But if the endometriosis is moderate to severe, then we see a lot of adhesions. Sometimes the uterus being stuck to the rectum, or the bladder, or the ovary being stuck to the rectum. So depending on the degree of endometriosis, we see various pictures on laparoscopy. So usually endometriosis is suspected on history as well as examination. But laparoscopy is one modality where we can diagnose endometriosis for sure.
For women who do not want to undergo surgery, they are like conservative, they don't want to undergo surgery, what are the other modalities to confirm it?
We can also do, advanced imaging techniques like CT and MRI. But laparoscopy is one thing which is both diagnostic as well as therapeutic. But these advanced imaging techniques like CT or MRI, they only confirm the diagnosis. They don't aid in they are not therapeutic to the patient. So laparoscopy is one such modality where you can also diagnose as well as you can drain those cysts, and probably the patients will feel better after the surgery. There is one more indirect blood marker called as CA-125. It is an indirect blood marker also, which is mild or moderately elevated.
It is not specific.
It is not specific.
Endometriosis.
It is mildly or moderately elevated in patients with endometriosis. So So this is a short video which is, throwing some light on what causes infertility in endometriosis and what are the various diagnostic modalities which can be applied to diagnose as well as treat endometriosis. So for any further queries, please feel free to write to us at ask@gunasheela.com. And in our further series, you can also have more knowledge on how do we treat
Treat
endometriosis.
endometriosis.
Thank you.
Thank you.